Good morning to all you beautiful people. This is Dr. Nick Ravon coming from Southern California. If you're a diabetic, what are the three classes of diabetic drugs that you should be on? Well, we always say as a diabetic, you want to lower the blood sugar without causing low blood sugars, and of course avoid adverse side effects of drugs. Exercise and lifestyle is the most important thing because there's lots of data and studies that show that if you exercise and you have a good lifestyle and a good diet, you may not need diabetes medicines, or you can regress diabetes or slow it down significantly. But if you have to be on diabetes drugs, the first drug of choice is a drug called metformin. Metformin is a very old drug. It works very effectively. It's well tolerated unless you have GI side effects from it. The biggest side effects of this drug is causes GI loose stools, gas, bloating, discomfort in the stomach too. There's good longevity data on metformin too. But for the purpose of this discussion, metformin should be the first drug you should go on. And it should not be the only drug you stay on for a long time either, because it really works on lowering your sugar production within the liver. It changes this thing called gluconeogenesis. By reducing the glucose production in the liver, that's where metformin works. The next class of drugs depends on how old you are and what is your body weight. So if you are an older patient who needs a small reduction of blood sugar with minimal risk, there are the family called DPP4 inhibitors. These are enzymes that prevent the breakdown of GLP-1. These drugs work very effectively. They lower the A1C, based on what data you look at, somewhere between 0.4 to 0.7%. And they don't cause hypoglycemia. They do not cause hypoglycemia. That works effectively. So that's good for someone who's thin, who's older, who just wants a little reduction of the blood sugar. Okay, that's the DPP4 family. And those drugs are drugs like Januvia, Tradjenta, very similar drugs, work very effectively, and they're great drugs for that purpose. The next class of drugs that you should be on is called SGLT2 inhibitors. These drugs specifically inhibit the glucose absorption in the kidney. At the transporters, they do not allow sugar to be absorbed within the kidney, and these drugs make you urinate glucose. These drugs are very, very good, very sought out for. They can cause weight loss because you lose calories in the what? In the urine as you pee your sugar out. So the problem with these drugs is if you are postmenopausal as a female, or if you have a history of recurrent urinary tract infection, this drug can actually make that worse. It can actually cause yeast infections and urinary tract infections. So it's a drug the doctor should be selective on who should go on this drug, but it's a very good drug for patients should be on. Another class of drugs that we use very effectively are called GLP-1 drugs. Those are the weight loss drugs. We've been using this class of drugs since 2005. Extremely successful drug. This is a drug for someone who has got diabetes and is overweight. So if you're diabetic and you're overweight, the GLP-1 family class is the right drug for you. So now we've talked about three drugs. Metformin is one class of drug that works on the liver. The SGLT2 drugs, they work very effectively by making you not absorb your sugar within the kidney, so you pee your sugar out very effectively. The other class of drugs called DPP4 inhibitors, and what they do is they prevent the breakdown of GLP-1 in the body. Therefore, your GLP-1, which is glycan-like peptide 1, that actually does what? That lasts longer. And if it lasts longer, then you can actually have better blood sugar control without hypoglycemia. So there's a three class of drugs that you should talk to your doctor to be on if you're a type 2 diabetic. So very straightforward. None of these drugs cause hypoglycemia. Now, on the flip side is if you fast prolongedly, you don't eat long after a long period of time, you can definitely get hypoglycemia-like symptoms. All right. So talk to your doctor to make sure you're on these class of drugs as a type 2 diabetic because they work very effectively. Make sure you ask for these three class of drugs. Okay. Hope that answers the questions.